Professor Siobhan O'Neill, how much does mental health play into the drug deaths that we're seeing on our streets and the problems for addicts across the city?
Well, yes, we're talking here about very vulnerable people who've experienced trauma. They have severe symptoms. It's affected their body and brain. Whenever they take substances, they can become dependent. And then you've got quite a sophisticated set of circumstances where you're dealing with, in terms of treatment, you're dealing with the impact of that trauma and the impact then of the substances on their bodies, and the social networks around them have often broken down. You know, and those are key components to mental health and well-being. So it requires specialist treatments that look at all of those factors. And unfortunately, the services that we have to provide those treatments are under such huge pressure at the minute that people often find themselves not being able to get that help.
What needs to happen? The Department of Health, you know, Public Health Agency will all say they're doing what they can.
So there are 2 plans that have been put in place, and people have worked very hard to develop them to make sure that they're robust. We have the Preventing Harm, Empowering Recovery strategy and the Mental Health strategy. What we need now is full funding to be released for both those strategies to be delivered in full. That means we'll have a workforce plan, we can train people up to provide these services, and we can also start to address those underlying issues, the early intervention, the prevention, the reduction of inequalities, and addressing those trauma-related issues that I'm talking about that are the root cause of all of this.